This is a second study of a patient originally seen at 14 weeks who seemed to have a slightly larger left ventricle than the right ventricle. And that is carried on again here at 21 weeks. We can see what looks like a normal pulmonary artery, normal-ish right-sized ventricle, but with endocardial fibroelastosis on the chordae tendineae of the right ventricle. Left ventricle is normal, and it's the left ventricle that's doing all the work. The right ventricle does not really have any squeeze. It's good-sized pulmonary arteries, so we think this is an acquired problem over time. Here we have a larger aorta than pulmonary artery, but no ventricular septal defect. You can see almost no flow going into the right ventricle, but a significant amount of tricuspid valve regurgitation. All the flow really goes into the left side of the heart. So this is pulmonary atresia with an intact ventricular septum. If there was no tricuspid valve regurgitation, we would be more concerned about coronary cameral fistulae, which we do not see in this particular case. There's the ductus in reverse, so that the blood going into the pulmonary arteries is coming from the ductus, from the ascending aorta through the ductus back into the pulmonary artery. And here's a look at the ductus in red going forward. And here's the size of the right ventricular outflow tract. Larger main pulmonary artery, but there was truly little, if any, flow across the pulmonary valve. This baby had pulmonary atresia when it was born.